Great Valley School District, we recognize the profound impact that mental health has on the overall well-being of individuals. We're committed to providing a learning environment that prioritizes optimal student development. In August of 2022, the school board approved the district's comprehensive plan that has guided the district's work through 2025. One of the established priorities of that plan dedicates resources to creating safe and inclusive spaces where students feel valued, respected, and are able to express themselves authentically.
The Great Valley School District continues to pride itself on supporting the whole child. However, in recent years, we have seen a significant increase in the diagnoses of student mental health disorders. However, this rise is not a recent phenomenon. There are some studies that indicate between 2011 and 2015 that student diagnoses with anxiety and depression increased by 28%. So this is a trend that we've seen on the horizon for the better part of 10 or 20 years. The pandemic has certainly magnified and intensified the concerns, and schools, as a result, have increased their personnel in a variety of areas.
Addressing the emotional and behavioral health needs of children and adolescents is a critical public health challenge. In 2021, the Surgeon General issued an advisory protecting youth mental health. The report highlighted recommendations for how schools, educators, and staff can support the mental health of all students. In order to foster a positive, safe, and affirming school environment, the district has partnered with both professional organizations and a private contractor who specializes in responsive approaches. Through these partnerships, the district continues to expand the implementation of a social and emotional learning framework, as well as evidence-based approaches that promote healthy development. We have used several fund sources at the federal, state, and local level to hire and train additional staff such as school counselors, mental health therapists, nurses, social workers, school psychologists, as well as dedicated staff to support students with disabilities. The district maintains active membership with the Chester County Consortium for Mental Health and Optimal Development, a partnership between the University of Pennsylvania and the Chester County Intermediate Unit. Collaboration with agencies such as the Crime Victims Center of Chester County, Be a Part of the Conversation, Holcomb, Patan, and the Pennsylvania Department of Human Services help us to provide professional development on topics of emotional intelligence, trauma-sensitive practices, social development, and belonging and improvement science. We recognize that creating safe and inclusive spaces is an ongoing process. We actively seek feedback from our students and use it to make continuous improvements. The district has committed to using assessment tools to gather information about student needs in several formats, including school-based universal mental health screening, surveys of belonging, and through participation in the Pennsylvania Youth Survey. At Great Valley, we believe that the development of positive relationships is key to creating safe and healthy environments for students. Positive self-concept starts with belonging and student agency. Our programming is aimed to promote student agency through activities that are meaningful to learners by providing voice and choice in how they learn. In doing so, we believe that students foster a greater investment of interest and motivation. The district is looking to prioritize education for students, staff, and community to help recognize signs and symptoms of mental health risk. The use of the state tool Safe to Say Something provides us with information that can help us to assess and address risk. All students, staff, and parents have access to this tool. The district utilizes programs such as Question, Persuade, Refer, and Youth Mental Health First Aid to provide preventative support to students. In addition to social, emotional, and academic skills that we aim to foster in our students, community support serves to buffer stressors and challenges and to help build students' overall resilience.